Well, welcome back, everyone, to Toula's Tips for Caregivers. My guests today are Andrea and Royce Hart. They are the owners and administrators of Bright Star Home Care Agency. And right before the break, we were talking about some of the different things that does distinguish them from the other home care agencies in town, because there are a number of them. And they have a new program called the HANDS program, which I'd like, if you would, Andrea, you to tell us about.
Well, what the HANDS program is, we were talking a little bit before the break about how hospitals are tasked now to really be looking at their readmission rates, which is the rate that they have patients come back into the hospital, and I guess they're looking at the time frames there. And what the HANDS program does, HANDS stands for Hospital Accelerated Discharge Service, but what that is that we send RN or a CNA, Certified Nursing Assistant, to the hospital to care for your loved one at the point of discharge. And the program is designed to prevent these hospital readmission, because there's a stat out there that says like within the first 24 hours is the most crucial time for a patient once they get discharged. And so we're really working to prevent that from happening. We work with, if you're a Medicare person, we work with the Medicare program in that Medicare coverage doesn't start, home health anyway, it doesn't start until 24 hours after discharge.
Right.
Which doesn't make a lot of sense, but
that's when they really need you. They're home, they're transitioning. What did the doctor say about this medication? I don't really remember. Did he say I could shower with this or not?
Or even if I have the medication, you don't even have it most times, and that's what our nurses, we'll send them there, they'll transport the patient, they'll get the they'll have the medications, they'll do the patient education portal, because a lot of times when you get discharged, they give you your paperwork and they try to explain it, but you know.
They go over it so quickly,
yeah,
and your family member's standing there, and it's just...
You're just ready to go.
You're ready to go, put me in that wheelchair, wheel me out.
Yes.
You're right. So it's a very difficult time. So this transition program, will the nurse then be listening to what some of the hospital nurse has to say about some of the discharge
talk to
plans?
them, and you know, nurse talk. They'll talk each other's
nurses talk. Yeah,
they'll talk each other's language, and then they'll explain it to you. And they're going home with you, so they'll do the safety assessment and make sure everything at the home is where it needs to be. You know, and just depending on the level that you want, they could stay there a few hours, and just that whole first 24 hours. You know, they'll be there with you, and they'll do the full, you know, they'll do the full plan of care. So that's a program we do have starting in August, and you can just call the office about that if you want to get some more information or want to sign up for it. It's 904-807-9955.
I'm sorry.
And I'll tell you something that's really important about that, because I go to a lot of hospitals. I won't say which one, but there are a lot of patients just sitting out there. They're waiting on their loved ones, and we know sometimes you don't really have a whole. I mean, you're not just not doing anything at the time that your loved one calls you and say, "Hey, I need a ride home from the hospital." But we're there on time, ready to pick up their meds, take them to their place of residence, and get them started on their care like right away.
That's super.
And the Medicare program's not to put a thumb down to them, but they can't provide that.
They can't do that because their regulations won't let them, and then again, that Medicare home health can't start until 24 hours after.
Exactly.
Like you said. So that transition service that you offer, and even like you mentioned, the transportation home, is a great boost. My days as a hospital social worker, there were times I had to put people in taxi cabs.
And that's a shame.
To send them home. That is a shame. It breaks your heart, actually, for those people, that there's nobody out there that can take off an hour from work or, you know, of their day to come and pick up a loved one and take them home. But it's the reality of this crazy world that we live in, that everybody's so busy these days.
We're cheaper than a taxi cab. Because I wouldn't want to put my loved one just got to the hospital in a taxi cab.
No, me either. But
people need their jobs, so they're
afraid to take off.
Can't take off.
Particularly in today's economic environment, people are afraid to take off unless they just really need to.
Right, you can't fault them for that, you know. But that's why they have, you know, people like us there to kind of fill in the gap.
that and the teaching component of it, I
Yes.
think, is so important, because again, it's so hard to remember once you got home what the nurse at the hospital might have said about this, that, or what the doctor may have said. I've experienced that with my own parents.
Yeah.
And I have a medical background, and I'm a medical social worker, and I've gotten home with my mom and thought, okay, now what did they say about this? You know?
Right.
So it's I think that's a real important service, to have another skilled RN there to be there and help listen to
Right.
some of that. And I can imagine that the hospitals would be, and like we mentioned in the future, calling for that service, because they're going to want to not have their patients readmitted within 30 days, because they don't want that being.
No, they don't. And even, that's why we have that program, and then we have another one, Clinical Pathways, which I know you're chomping at the bit to talk about.
That's your disease management program. So,
And it's really neat because we had a clinician at the home office. She put it together based off of something called Coleman Care Transition Intervention Program. And that program actually resulted in a 50% reduction of readmissions in 30 days.
What was the name of that program again?
It's called Coleman Care Transition Intervention Program. It's in the research in the literature.
Okay.
You can look that up. But
Okay.
our program was based off of that program.
Wow.
In clinical studies, when they did the studies, it showed that the ones that participated in that program had a 50% reduction in readmits
hospital
for the first 30
readmissions.
days. Yeah,
That's a huge,
it is.
huge benefit there.
It is. So it's proven, but the program is based off of that. But it's focused on disease management, what we call pathways, and what those are. The pathways are like heart failure, COPD, ammonia. Those are the ones we have right now. We're working on diabetes and dementia, and in the future, we'll have heart attack, falls, fractures, Parkinson's disease, cerebral vascular accident, which is your traumatic brain injury, and chronic wounds. But basically what we do is we have our RN visit the client, and we have CNAs, certified nursing assistants, trained in that particular pathway. So they know the education, they can do the patient education, they know the things around safety, just whatever you need, like for heart failure, for example, they'll be able to monitor the symptoms, they'll check the weight, they'll check, monitor and check home for safety, food, meds, equipment, and they'll assist with your activities and exercise, really based on that particular pathway.
Yeah, that's just a fancy word for, we're going to give you, for people who may not be familiar with clinical pathways, it's really just a fancy word for, we're going to tailor the care that you need to the disease that you have. We're going to look at the medicines. We're going to look at the proper amount of exercise that you may or may not need. For congestive heart failure, for instance, you mentioned the importance of checking the diet.
Right.
Check for fluid and fluid overload. And, you know, it's the specific disease management that you will need for that specific disease to make sure, again, that disease doesn't exacerbate and cause problems again. Such an important service.
Because one size does not fit all when it comes to these things. And we know there's individuals that might have one or many of those. So we do have 2 levels of programming for those that do just have one disease that they're dealing with, or ones that have more than that. And
we know most seniors have more than one disease, and so to be able to manage it all together is really an important thing. Andrew, we have a caller on line 1. John, welcome to Toula's Tips for Caregivers. Hey John, how are you? Tell me about that.
Definitely.
They're not.
So John, I'm sorry, go ahead. They do.
They do. They're not allowed to recommend a particular in-home care or home health service. They usually have lists, and they just say, well, here's the list of our 138.
Right. That's about how many there are in Jacksonville, believe it or not.
And you can just pick theirs, or you can go to ours, which we have, but they don't recommend it. Sometimes it's up to the consumer to just be their own best advocate.
Hey John, do me a favor and hold on through the break. I'm going to talk about this just a little bit more, because that's a really important question that you asked, and with my background as a medical social worker, I can help add to a little bit of this,
Oh, yeah.
okay? Thank you. We'll be back after this commercial break. You're listening to Toula's Tips for Caregivers on Talk Radio 600 WBOB.